So this is the area that I work with my provider, my doctor. He sits over here. See, we kind of personalize it a little bit. He has his laptop here. This is kind of considered our medical workup area. And this is where I sit with my laptop here. And then we have the desktop here. And then I have what's called a helper right here. And what she does is she helps me room patients, helps me answer calls, take messages, give injections, do all sorts of testing. Each pod is what we call, this is our pod. Each pod has 3 exam rooms. 3 exam rooms. So during a set of hours is what we call it. We'll see patients routinely through those. Putting patients in the rooms is primarily what we do. Helping the doctor when he comes out. He gives us orders, things we need to do. We would work them up right through there. So I have my daughter, she volunteered to do this little project. So I'm gonna always knock before we go in a patient's room. Hello, Mrs. Courtney, how are you today?
Great.
So I'm just gonna kind of show you around the basic exam room.
Epod, don't show my face.
Oh, sorry. So here we have, what do we have here, ladies? We have the otoscope, ophthalmoscope. We have the covers for those. Tuning forks, which I know we haven't gotten into all of that yet. Tuning forks, percussion hammer, sharps container, lotion, antibiotic, and bacterial ointment. Here I have my temporal thermometer that I'm going to use. I have my pulse oximeter to do a pulse and an oxygen. We've kind of limited what we've put in our cupboards up here because people during COVID have been stealing things from us. So we've kind of limited what we put up here. But we'll just kind of give you an idea of some of the things that you'll find in an exam room. 4x4 gauze, we have some iodine, peroxide. This would be for cleaning ears, doing any sort of treatment in the room. Generally, we do those in the treatment rooms. This is for any sort of rectal exam, GYN exam. We have some wound care supplies in here, alcohol pads, strep swabs, all sorts of things, stool cards, cotton swabs, bonus points if you know what this is. Speculum, very good. All right, and then down below, we have gowns, different size gowns, and we have sheets or drapes. We have a regular garbage, and we have a biohazard, which we hide way back there because we pay for biohazard, and more often than not, most everything can go in the regular trash. Basically, the rule is if it's dripping blood, then it goes into the biohazard. Here we have our sphygmomanometer, and we have 2 different size cups, and we'll get into that when we talk about vitals, but here's a large, and here's a regular. And then we'll talk about size and how we go through and measure a size a little bit farther on. So I'm just gonna flip the camera around.
Just do it that
Okay. And hopefully you guys can see me okay. Patients often laugh at me. Okay. So, arms should be uncovered. If they have a real thin, no, that's fine. If they have a thin shirt on, then it's usually fine once you get really good at hearing them. But for learning and training, shirt should be up. You don't generally massage their arms like that, but she's my kid. Stethoscope. Get in the habit of always having your stethoscope on your neck. I wear this, I basically wake up with it and go to sleep with it. But when you're in the office, having it around your neck, having it with you available, especially if there's an emergency or something, and it's easier than putting it down on the desk and picking it up. Always have it on your neck. Get used to that. So, and I'll do a video when we do blood pressures, but for now I'm just going to kind of do quick Here's our artery mark. We look for a brachial artery. Measure it up, 2 inches from the brachial artery. Wrap it around, and just wrapping the arm sometimes is the hardest part. Once you get a secure fit, you make sure you're hooked up. I'll put this thing back over here. Stethoscope in my ears. Pointing up, facing up. I'll step over here so you can see this. Hopefully. Make sure their legs are uncrossed.
Do you want to hold it so you can see that?
Oh, sure. Also, sometimes I'll ask the patient, what is your normal blood pressure? Or I'll look in their chart. If they're a regular patient, I'll look and see what they were in the past. That gives us an idea how far we should pump them up. We don't want to pump somebody up to 200 if we don't have to. But yeah, we want to pump them up so that we know we're getting an accurate reading. Then I release the valve. And what I'm waiting for is to hear the first Korsakoff sound. Then once I hear it, I wait for it to disappear, release the valve, take that cuff off because it's been pumped up, their arm's sore. Very good. I got 128/72.
Is that good?
That's very good. Patients will always ask you that. So you need to be able to tell them if it's good, if it's in range. Obviously, that's up to the doctor to determine if that's good for them, but knowing the basic parameters is very important. I'm going to take a temperature with a temporal thermometer. Some things to keep in mind: if someone has a hat on when they first come in and you know you're going to be taking a temperature, have them take the hat off. If their head is moist and sweaty, give them a paper towel to blot it. Cleaning this prior to use, alcohol swab. For a temperature, you don't need gloves on. Blood pressures, you don't need gloves. Every office may be different. During COVID, things are very different. Every office has different protocols. Temporal thermometer to the forehead. Depress the button to the temple, behind the ear. 98.6. Couldn't be more perfect than that. Very good. We'll do that one more time. Forehead, compress the button to the side, behind the ear, 98.4. All right, very good. Next, we're going to take a pulse. Now, a pulse we generally are taking manually, meaning I'm feeling for your pulse. So that's what I'm going to do first. So I'm going to count 15 seconds. Now, we're going to count 30 seconds when we practice. When we start, my watch is dead. What the heck?
Use mine.
That's so weird. What happened to it? So we're going to go 30
Technical
seconds.
difficulties.
Yeah. There it goes.
You got it?
There it is. Okay. So we're going to find the apical pulse, and we'll learn more about these. Apical pulse is on the thumb side. Radial pulse is on the pinky side. So we always go to the apical pulse.